scars themselves were just disfiguring and always made me self-conscious.
The pain is like your skin stretching over something where it doesn't fit. When I put on the scarline, probably within 1 or 2 days, I could feel the pain going away.
It definitely affected my quality of life in terms of scheduling, always being focused on what's on my body rather than what I should be focused on.
Scarline RX is a family of silicone products that's designed to not only treat hypertrophic and keloid scars, also it improves the appearance of people even with normal scarring mechanisms if used correctly. There are plastic surgery options. Many of them require repeat surgery, which obviously is not only expensive but painful to the patient. Silicone is a non-invasive way of treating these scars without necessarily having to go to surgery. Applying silicone improves the wound's overall state of hydration. The theory states that cell signaling in the epidermis causes cytokines to go to the fibroblasts and basically tell them to either shut down or reduce their production.
When I came in to have a benign tumor removed, Dr. Bruce and Will Hawkins told me about scarline, because I knew that I was going to have at least a 2-inch scar on my side. And in my case, it's actually prevented any overgrowth to occur.
It's painless, very easy to use, very easy to apply, and I think from a day-to-day perspective, you forget that you're even utilizing it.
Scarline is very easy to use. There are different sizes depending upon what your needs are.
You need to apply it over the scar with about a 1/4 inch to 1/2 inch overlap and leave it there for 12 hours a day for 3 months. After that, your scar should look great. A scar for a breast surgery patient is a pretty big emotional deal. We have the only molded part that will fit perfectly over the nipple areolar complex.
In the back of my mind, I also thought, oh my gosh, it's going to cost me $1,000. But you know, when I actually went and ordered it, I was really impressed with how affordable it was.
A routine surgery in a plastic surgeon's office may cost you between $2,000 and $5,000. If you have that at an outpatient surgical center or at a regular hospital, these can cost you on the order of $15,000 to $30,000. In comparison, Scarline RX costs roughly $20 a month for 3 months of therapy, which is the recommended duration of therapy. I've done a series of thyroidectomy patients in our clinic with normal scarring mechanisms, and we found that when scarline was applied to one side of the scar as opposed to the other side of the scar, that the level of elevation of the scars were reduced in the side using Scarline RX. After reviewing close to 800 studies, it's clear that silicone is the #1 scar reducer.
I was really happy that the scar almost immediately changed in size, color, and it didn't hurt as much.
I am so pleased with Scarline. In the past, I have had to go back to the doctor for repeated visits to get an injection of a steroid. So Scarline is fantastic. You know, no needles, very easy to do.
The philosophy I have as a physician is similar to what Scarline is as a company, and that is if you put the patient first, you'll never go wrong.